Most of the materials required for insertion of the Vantas implant are provided in the Vantas implantation kit. The Vantas implantation device and the Vantas implant itself are supplied separately. The implant should be kept refrigerated until immediately prior to the procedure. Pour the sterile contents, including the implant, onto the drape, using sterile gauze to absorb the excess liquid. The next step is to select and prepare the intended site of the implant. Select the non-dominant arm. The optimum site for placement of the implant is halfway between the elbow and shoulder, approximately 4 to 5 centimeters from the elbow, in line with the crease between the biceps and triceps muscles. You may wish to mark the intended site of the implant before proceeding. Swab the insertion area with topical antiseptic. And overlay with the fenestrated sterile field drape provided. Now the implantation device can be prepared. The green retraction button controls the movement of the cannula and is used to release the implant when in the correct position under the skin. Ensure that the green retraction button is pushed fully forward and locked in place with the cannula fully extended. Grasp the implant with gloved fingertips or a mosquito clamp or forceps. Note that the implant may come out of the vial slightly curved after refrigerated storage. If this is the case, make the implant more symmetrical by gently rolling it between the thumb and forefinger of a gloved hand. The implant should be placed inside the bore of the cannula so that only the tip of the implant is visible. Do not force the implant into the device. If resistance is felt, remove the implant and roll it again before reinserting. When you're happy that the implant is correctly loaded, you can proceed to administer anesthetic. The method of anesthesia used is at the discretion of the healthcare provider. If using local anesthetic, inject into the subcutaneous tissue at the planned incision site, then infiltrate along the intended path of the implant for approximately 3 centimeters. Make a shallow incision transverse to the long axis of the arm and of a size adequate to allow the bore of the cannula to be inserted into the subcutaneous tissue. If necessary, the incision can be opened or widened using a mosquito clamp or forceps. Insertion may be made easier if a pocket for the implant is made subcutaneously along the path of the anesthetic using the cannula of the loaded insertion device or another appropriate tool. To place the implant, advance the device forward so that the cannula enters the pocket completely, no further than the inscribed black line. While holding the insertion tool firmly in place with the base against the patient's arm, press the green retraction button to release the locking mechanism. Then slide the button back towards the handle while keeping the body of the device in place. Do not further advance the cannula once the retraction process has started. Retraction causes the cannula to withdraw from the incision, leaving the implant in the subcutaneous tissue. Apply pressure to the skin over the implant whilst withdrawing the device from the incision to ensure that the implant remains in the subcutaneous position. Once the implant is in place with the cannula withdrawn, confirm proper placement of the implant just beneath the skin by palpating the surface. Briefly cover with a sterile gauze pad and apply pressure. Surgical strips are usually sufficient to close the incision. If required, 1 or 2 absorbable sutures can be used with the knots facing inside the incision. Once closed, cover the insertion site with sterile gauze pads and secure the dressing with the bandage provided.